Hi, my name is Navdeep and I'm going to discuss the nursing process topic today. And for that, I'm going to share my screen. Okay, so first is the definition of the nursing process. What do you understand by the nursing process? So, nursing process is a critical thinking process that professional nurses use to apply the best available evidence to caregiving and promoting human functions and responses to health and illness. And for every process, there are different steps. For nurses, also, there are some steps so that we can follow that steps and provide the best care to individuals or our patients. And in this, we have to maintain the dignity of the patient and rights of the patient by using our critical thinking. And for that, we are used to do the different steps in the nursing field. So, this is basically according to the American Nursing Association nursing process, which we follow today's. And nursing process is a systematic method of providing care to client, and whatever we follow related to the nursing process, that method would be the systematic, means it is going to the steps by steps from after. For example, firstly we do the assessment of the patient, and after that we do the planning of the patient according to the patient's needs, and then we follow the different steps of nursing process, that is the diagnosis and nursing implementations, interventions, and at last we need to do the evaluation of the process, whether whatever we do, can we do the best possible things for the patient so that we can maintain the health of the patients. So the nursing process is a systematic method of planning and providing individualized nursing care in nursing process. This is the systematic method of planning. What we plan, it is based on the system, and what we provide, it's based on the nursing care plan according to the individualization needs and priorities as well as problems. And next is the purposes of nursing process. What do you understand by the purposes? Purposes means why we have the nursing process to be essential to maintain the client's care. In that, the main purpose is to identify a client's health status. While using the nursing process steps, we are going to identify the health status of the client as well as their actual as well as oncoming healthcare problems or the need, so that we can do according to that needs care plan. So next is the to establish plans to meet the identified needs. In this, we have to establish or maintaining, or we have to introducing a new plan so that our patient needs will be met. And the third one is to deliver specific nursing interventions to meet those needs. Firstly, we identify the health status, and after that we have to establish the plan according to the health problem, and after that we have to intervene that step. Intervene means providing that care, whatever we will do the action for the patient client's needs. Next is the components of the nursing process. Nursing process involves different kinds of or different steps of nursing process. It involves the first is the assessment, and second is the nursing diagnosis and nursing plannings, nursing interventions or implementation, and then at last we need to evaluate the patient condition. So now in assessment we need to identify the patient health problems, and in that we need to collect the data from the patient. And in assessment we have two steps, that is the subjective data as well as the objective data. From the patients we have to take the subjective data, and for ourselves we have to do the objective assessments. In that, the patient's complaints are comes under the subjective data, and whatever we observe in the patient or whatever we observe the sign and symptoms in the patient is comes under the objective data. So next is the after assessment, and in assessment we also have to make sure that patient sign and symptoms, and we also read the lab investigations, and in assessment we collect all the data regarding the patient conditions from wherever we have to be possibilities, like from their files, from their health history, from their past history, from their family history. We have to assess the patient's condition before or nowadays also. So next step after assessment, we have to do the nursing diagnosis, and there are so many diagnoses according to the needs of the patients, and we are using the Nanda diagnosis. After that, we have to do the planning, that whatever we diagnose the patient according to the situation, and after that we need to do the planning, whatever we are doing for the patients to improve their health conditions. And after that we are doing the implementation means whatever the steps we are taken for the patients, and whatever the needs of the patient, according to that we have to provide the care to the patient, and we have to need to take the steps of that needs to the patients. And at last we have to evaluate the patient, and after giving the interventions, for example, if the patient has the pain score is 6 or 7, so for that we have to intervention, or we have the implementations of how to reduce the pain. For reducing the pain we have to take the steps. For example, we are doing the diversional therapies of the patient, distracting their minds and engaging in some other activity so that the patient pain will be reduced. And in other terms, we are also giving the painkillers to the patient. These comes under the interventions. And we also helps in reducing the pain by providing or by helping in taking the deep breathing exercise so that the patient mind get diverted and the pain will get reduced from 6 to 7 to 3. And in evaluation, same thing, as whatever we have done, is that works on the patient or not. Next is the characteristics of nursing process. Nursing process is the cyclic dynamic nature. Cyclic means ongoing process. Dynamic nature means according to the needs of the patient, we have to change the nursing process. And it is the client centeredness, means it based on the patient or individualization, and it basically focus on problem solving and as well as decision making. For example, we are taking the steps for solving the problems, and according to that we are taking the steps of the patients. Next is it is the interpersonal and collaborative style, means we have to involve the person also, we have to involve the patient also, and we have to involve the other team members or other team staff to maintain, to improve the condition of the patient. And it is the universal applicability. Universal applicability means it is ongoing process and it is the universal process, and we have to apply this all over the universe. And next is the uses of critical thinking and clinical reasoning. While taking the steps of the patient, we need to use our critical thinking so that we can improve the health condition of the patient, and we have to use the proper method for the patient's conditions to be better. Next is the same thing in assessing: collect data, organize data, validate data, and document data. Definition of the assessment is the systematic, continuous collection, organization, validation, and documentation of data. Everything I have discussed this before, that it is the systematic process, continuous process, and it needs some validation. There are different kinds of assessment. There are four different kinds of assessment. That is, first is the initial nursing assessment, problem focused assessment, emergency assessment, and time lapsed reassessment. And in first initial nursing assessment means when the patient comes and have the admission in the hospital, at that time we are using the triage system towards the patient that who needs the most priority for the healthcare. So according to that, we triage the patient and provide the care to according to that according to that needs. And firstly, initial nursing day assessment performed within specified times after admission. So to establish a complete database for problem identification, for example, nursing admission assessment, as the nurses can do their own assessment, and according to that, they triage the patient. And second is the problem focused assessment. In problem focused assessment, we have to determine the status of the specific problem identified in an earlier assessment. Means we have to focus on the particular problem of the patient. For example, if the patient comes to the hospital and with the complaint of fever, so we have the care plan according to the patient condition, and the main problem for that patient is the fever. So we have to continue with that assessment, that we have to checking the vital signs every hourly, so that we can continue with the assessment of the patient, whether the patient temperature goes down or it's better or it's not or it's worsening, so that according to that we have to take the next step. Next is the emergency assessment. Emergency assessment is the assessment during the emergency time we have to do to identify any life-threatening situations. For example, rapid assessment of an individual airway, breathing status, and circulation during a cardiac arrest. For example, we have to follow the ABC pattern: airway, breathing, circulation, and at that time when the patient had a cardiac arrest, we have to immediately check the airway of the patient, and we have to check the breathing status by head tilt, chin maneuver, and we have to see the rise and fall in the chest of the patient. And in the circulation, we have to check the carotid pulses also, so that according to that we provide the emergency care to the patients. And next is the time lapsed reassessment. Time lapse means after some time we have to do the again reassessment. Several months after getting discharged from the hospital, we are doing the reassessment of the patient, and to compare the client current health status and with the previously data we have to obtain during the admission time. So in the follow-up also we have to do this reassessment, time lapse reassessment, and doctors are also doing the reassessment by checking the lab investigations at the time of the admission and at the time of the discharge and at the time of the follow-up, and they will compare that lab investigation with each other, and they can find out that whether the patient condition is good or not. For example, if the patient comes in the hospital with the high cholesterol, and after taking the medication in the hospital, the cholesterol level becomes at the normal level, and once the patient get discharged, and after that on follow-up we also check the patient cholesterol level, and we have to maintain that level, that normal level of the patient, so that we get from the lab investigations. Next is the collection of data. Data collection is the process of gathering information about a client's health status. It includes the health history, physical examination, results of laboratory and diagnostic test, and material contributed by other personals. Means in the collection of data, we have to collect the patient history with their physical examination, for example, from head to assessment, and results of the lab diagnostic test and other material, for example diet plan of the patient, so that we can provide the best care to the individual or the patient. Next is the type of data. There are two types of data: subjective data and objective data. Subjective data also refer to as symptoms. Subjective means what the patient tells to us. For example, itching, pain, feeling of worry. These are the subjective data. And second one is the objective data. That objective data is the data which we have to see on or observe on the patient. For example, we have to see that patient facial expression is looking like he or she is in pain, and we also observe there is little bit edema and around the eyes, around the lips, and other things. We have to do the respiratory assessment, and in that assessment we have to heard the wheezing sounds in the asthmatic patient. That comes under the objective data. Or we have to see the discoloration of the skin and blood pressure reading. That is the objective data. Objective data is the data which the nurse can get, nurse can feel, and nurse can hear, and nurse can smell from the patient. Look, listen and feel by the nurses comes under the objective data. Next is the sources of data. There are two different sources of data from where we get the data of the patient, from primary sources as well as secondary sources. Primary sources is the patient themselves, and secondary sources from other individuals or family members, health professional, their records, their files, their discharge summary, their lab investigations. These comes under secondary. And next is the method of data collection. How we collect the data from the patient: by observation, and by observation by look, listen and feel, and by interview with the patient, and by communication with the patient. Patient can tell us the problems. And there are two approaches to interviewing: directive and non-directive. The directive interview is highly structured and directly asked from the questions, and non-directive means the nurses allow the client to control the interview. Directive means openly questions, and non-directive means closed one. Then next is the examination, physical examination. It is also the systematic data collection method in which we examine the patient. For example, if the patient have the respiratory condition, then we do the respiratory assessment. If the patient have the cardiovascular problem, then we do the cardiovascular assessment, and we can hear the sounds of the heart like glub, dub, and any other abnormalities. And in the examination, we follow the steps for like inspection, palpation, percussion, and auscultation. And in abdominal assessment, we always do the palpation at the last. Next is the diagnosis. According to the diagnosis, the second phase of the nursing process. In this phase, nurses use critical thinking skills to interpret assessment data to identify client's problem. There are different kinds of nursing diagnosis. We are using the Nanda definition of nursing diagnosis. And there are three components of the nursing diagnosis. First is the problem and its definition, and second one is etiology, and third one is the defining characteristics. For example, the first nursing diagnosis is the patient has suffering from the pain. So we start with the diagnosis acute pain related to the abdominal surgery. Abdominal surgery means what are the cause behind the pain? It means the abdominal surgery. As evidenced by patient discomfort and pain scale. As evidence by means from where we have get the information that patient has this priority. So patient has discomfort and pain, and we are using the pain scale, and the patient says that I have pain 6 or 7. Next is these all are the Nanda diagnosis which we are do according to the patient needs. Next is the planning. In planning, what we need to remember, firstly, we prioritize the problem according to the needs, according to the assessment. We always follow the ABC and airway, breathing, and circulation. And according to that, we are going to do the planning of the patient. Next is the formulate goals, and what are the goals and desired outcomes, whatever we are planning. And for that is the goal oriented, is our goal or our desired outcome will come with that. And after that, we have to select the interventions according to the patient needs, and we also involve the patient in the nursing interventions. Planning is the process of formulating client goals so that we can achieve the goals and we can reduce the patient problem. So by taking the steps, for example, to prevent the patient from the bed sores, to reduce the pain, or to eliminate the client health problems. Planning is of three types: initial, ongoing, and discharge planning. And there are some different needs of the patient, that physiological needs, food, water, warmth, and rest. We always give the preference to these needs, and safety needs, security, as well as these are all comes under the basic needs of the patient: belongingness, their relationship with the friends, and esteems needs, feeling of accomplishment, and self-actualization. These all are the needs which we have to take care when we are providing the care to the patient. Next is the nursing interventions. Nursing intervention is any action that we are taking to reduce or to promote the comfort or to prevent the further problem to the patient. In intervention, we always involve the patient and we are maintaining the nursing care plan. Next is the implementation. Whatever we are taking the steps, we are going to implement that steps, and with that step, patient needs are to be met. And last one is the evaluation. In evaluation is also a planned ongoing purposeful activity in which the nurse determines the client progress towards achievement of goals, outcomes, and effectiveness of nursing care plan. And in the evaluation, we have to compare the data with the desired outcome, and we have to maintain the patient safety, security. So after that, we have to evaluate whether the outcome will be on the positive way, whatever we are taking the steps for the patient to maintain the client's needs, to meet the client's needs, whether our goal is achieved or not. So in this evaluation, we have to evaluate, we have to do the again assessment of the patient so that we can know more about the patient condition at last. Thank you so much. And today I have discussed the nursing process. And in the nursing process, I have discussed the steps, that is the assessment, nursing diagnosis, and planning, implementation, interventions, implementation, and evaluation. So these are the steps. If there is any question about that, please let me know.